So, Bismillah Rahman Rahim, the topic is lethal fetal anomalies. As you know, the anomalies are abnormalities, and the objectives of this presentation are to discuss the skeletal lethal anomalies, renal lethal anomalies, central nervous system anomalies, other lethal anomalies. We will touch the conclusions, managements, or recommendations, and other reviews. For skeletal lethal anomalies, the most important are thanatophoric dysplasia, osteogenesis imperfecta type 2, achondrogenesis, congenital hypophosphatasia, short rib polydactyly syndrome, achondroplasia. In renal lethal anomalies, we have bilateral renal agenesis, polycystic renal disease, multicystic dysplastic kidney, if it is bilateral, Macker-Gruber syndrome. In CNS, we have anencephaly, A-lobar holoprosencephaly, einencephaly, hydranencephaly. Other lethal anomalies which we will be discussing are Patau syndrome, prawn belly syndrome, body star syndrome, multiple pterygium, and triploidy. First, we will be discussing the lethal skeletal dysplasias. Ultrasound diagnosis typically made in second trimester, and neonate cannot survive usually due to respiratory failure. First is thanatophoric dysplasia. It is most common lethal skeletal dysplasias, new autosomal dominant mutation of FGFR3 gene. Incidence is 1 out of 6,000 to 17,000 pregnancies. Severe rhizomelia. Rhizomelia means proximal shortening, bowed long bones, narrow thorax, short ribs, flattened vertebral bodies, cloverleaf skull, large head with prominent forehead. And we also get depressed nasal bridge in thanatophoric dysplasias. They look like this. This is thanatophoric dysplasia 1 and thanatophoric dysplasia type 2. In type 2, we get the cloverleaf-like head. In type 1, there is more bowing of the femurs. The long bones are short, and in type 2, we can get fractures of the ribs. The tummy appears to be protrudent, and there will be narrow thorax, flattened vertebral bodies, and nasal bone will be like this, depressed nasal bone. This is normal fetal face profile and abnormal from the side. So on ultrasound, we can have type 1 and type 2. In type 1, ends of the femur are curved in a telephone receiver, telephone dial-like appearance like this. Mild misshaping of the skull is seen. Whereas in type 2, the femur is straight, but severe craniosynostosis producing a clover leaf appearance to the skull. This is a clover leaf, and it appears like that. This was a neonate, a newborn with thanatophoric dysplasia type 2. Survival rate is very low. That's why it is considered one of the lethal fetal anomalies.